Good afternoon. Hello. I hope you can all hear me. If somebody could perhaps go into the chat and just give me a quick thumbs up to make sure that my microphone's working as expected, that would be fantastic. But welcome everybody. Welcome to this, our second loud and clear, Lauren. Thank you very much. Our second learning lunch of the year. Welcome everybody. I'm going to give it another couple of minutes just to get a few more folks onto the system, and then we'll get started. So if you can just bear with me, we'll get started at 12:30 on the dot. Thank you. Right, well, I make it 12:30, so we'll make a start. This is, as I said previously, this is the learning lunch. I'm from Piota Healthcare Apps. Let's just go through. Oops, problem with my keyboard. Right, sorry about that. So let's start again. So this particular learning lunch event is called Transforming Patient Aftercare and Staff Engagement, and how healthcare apps can make a difference. So I'm just going to introduce myself initially. My name's Chris Elkin. I've been within the digital media industry for more years than I care to remember. I spent a long time working for the NHS directly, managing their website and intranet pages. I started to produce apps, won awards for some of the apps that we created, and I've been with Piota now for about 4 years. So, yeah, I'm bordering on 14 years NHS experience. I'm really interested, and as an organisation, we're really interested in making life easy for people. And when I say people, we're talking about patients, families, and carers, and more commonly now, making it easy for colleagues. The digital media, the digital marketplace is getting more and more advanced, and we're looking to see how we can use mobile phones to make people's life easier. And I think if we can do that, we're kind of halfway. We're succeeding, we're winning. Just a little bit about Piota. I'm going to make a bold claim here, but I'd say we're probably a leading provider of patient support apps to the NHS. We've got over 120, 130 apps now in the health and social care area. Some of our clients include NHS England, Public Health Wales. We work with probably half of the Scottish health boards, and then lots of different trusts, ICBs, ICSs, the old CCGs, different trusts, different teams, and everything along that spectrum. So as I say, probably one of the biggest providers in terms of experience and breadth of experience within this particular sector. We have an app platform. It's called the Piota app platform, and we can quickly customize that for the needs of our clients. All our apps look the same. It's a platform that we're licensing. So these are very much patient-related apps. The first one was maternity. This is a diabetes app. This is a cancer app. So you can see healthy eating. The app lends itself across most conditions, and in terms of staff engagement and communications, it can help in a lot of different areas as well. So more examples. This is an example of a transition app. This is for young kids going into hospital for surgery for the first time. This is a staff engagement app, which I'll show a little bit more about a little bit later on. This is a paediatric protocols and guidelines directly for staff. And again, we'll talk about that in a bit more detail a little bit later on. For care homes, for domestics, and cleaners and other estate staff, and another sort of staff engagement app. So it's the same platform that we're using. We're customizing it for the needs of our clients. It's super quick, super easy to use, tried and tested, and it's sort of out there and really working. So let's have a quick look. Let's delve into this. Let's look into the first area. And historically, it's been about improving the patient experience. So being able to provide a quick and easy to use app that can be accessed anywhere, providing you've got your smart device. And it's not just for patients, it's for families and carers as well. In some of these instances, in some of the areas, it's just as important that the carers have the right information, the correct information, and it is as a patient. So being able to provide as a service, be able to provide your patients, their families, their carers with information quickly and easily on their smartphones. So this is the first example that I'm going to talk about. This is for Morecambe Bay. This is from the maternity team. It was one of the digital midwives there that commissioned this particular app. As you can see there, top half of the screen, we've got their sort of logo, their branding, and the bottom half of the screen, we've got this sort of 3x3 grid, which we call the tiles. These tiles have labels and icons, and the idea is that anybody can pick this up once you download it onto your device, and you can then go through that pathway relatively quickly. Clicking on any of the buttons will take you through to the different areas of the app. This one is about referral forms, so right at the very beginning of that journey. There's embedded YouTube videos, so you can have a little look around, virtual look around the different birthing units to see, as new parents, where you'd like to go and give birth. Lots of great information, but all of the information here is provided directly from the team at Morecambe Bay. It's not generic information, it's very sort of localized, very specific to their service, how they operate and how they do things there. Lots of information there about, for newborn babies. I think this one's particularly about jaundice. All of the apps come with a real quick and easy to use contacts directory. Pressing on any of these buttons will take you directly through to those different departments or those different teams or those different individuals. It's super easy to use, and that's what we're driving at. We're wanting to make people's lives easier. If I can click on one of those buttons and speak to somebody, I don't have to try and put the numbers in and call and get through. It's just about straight through direct communication, making it really simple, making it easy. Because it's a mobile phone app, we can use push notifications and alerts. So if anything changes within the service, you can quickly come onto the app itself, create some content, and then send that out as a push notification and alert. And that will give you a little sort of reminder on your phone or on your smart device, and then you can see kind of what's happening, almost like a little virtual tap on the shoulder. So a really great way. Everyone's using phones these days, so having a mobile phone app for the maternity team there was fantastic for them. Moving on a little bit further into a different area. Still a patient app. This one's for a Macmillan Support and Information Centre up at Chesterfield, and it's the same platform. It's the Piota platform. Top half of the screen, there is some branding, some imagery, and then again below that we have this sort of 3x3 grid with the tiles and the labels. The functions behind the tiles and labels can be customised depending on the needs of the team. But if we dive into this one. This is information about the centre itself, and again, all the content here, all the pictures, all the imagery, it's all being sort of created and put onto the system and deployed directly by the manager, well, directly by one of the team at Chesterfield. There's an editor to the solution that we've got, a simple web editor that allows you to quickly get the content onto the system and then distribute it. So they've got lots of information on there. This is information they put on themselves, so they run a buddy scheme. But it's all the information around Chesterfield and how they work, the support services they offer, the financial advice that they can provide. And again, it's all links to localized centres or service providers. So it's all about for the patient, that sort of almost virtual comfort blanket. I can pick up my phone, I can, when I'm ready, I can go through the different areas and find the information that I need really, really quickly. There's information there about welfare and monies, What we've also got within the app is the ability to translate the content. So if you have communities where English is possibly not their first language, the app can translate, using Google Translate, can translate into a whole host of different languages very quickly, very easily, which again, has been adopted by a lot of our clients who are providing sort of patient apps where their demographics aren't necessarily, British. This particular app again has a contact section, and these are the different teams or different sort of centres. And again, clicking on the call button would activate your phone, and you'd be speaking to somebody in no time at all. Really quick, really easy. Don't have to think about it too much. And if you don't have to think about it, I think you're more likely to do it. The minute you have to start thinking about different things, and you can get sidetracked, and you possibly don't carry through on the task. So the easier we can make it for people, the better. So historically, we've all been about sort of patient engagement and improving the patient experience. But more commonly now, we're seeing more and more teams using mobile apps to improve staff engagement or to improve efficiency within different teams. And this has really been a trend over the last year or so. So a similar sort of scenario, it's about providing local information directly to your colleagues, to your staff, and this has been especially keen with clinical areas where it's been identified that not all clinicians have direct access to a computer, that don't necessarily have the time to browse the intranet and find information out about job opportunities or training opportunities or staff benefits. So we keep coming across a term which is sort of digital exclusion almost, where we're finding sort of clinical staff just don't have the time or the capability to access computers during work time, and therefore missing out on a lot of opportunities. I think within the People's Price some time ago, the NHS talked about inclusivity, ensuring that everybody has the same opportunities. But if you do work in a clinical area, or you are a domestic, or you are a cleaner, where you don't have access to a computer, you can't access the trust intranet, then you're at a disadvantage straight away. So we're seeing more and more organisations sort of identify this particular issue, this sort of digital exclusion, and are therefore looking at sort of innovative ways that they can kind of get around that. So we're seeing more and more organisations again looking at apps. Everyone's got one, everyone's carrying them around, whether you're on the bus coming into work, or whether you're sat in the staff room, or just having a minute. Most people have got their phones on their persons at some stage, so why wouldn't you want to sort of reach out and engage or improve engagement with your colleagues using these technologies? So this is one that we produced some time ago for St Helena Knowsley NHS Trust up in the northwest, and again this includes all the information they need in terms of for their colleagues about their workplace, opportunities that are available to them, different technologies. So almost like one-stop shop. Where I can pull my phone out and just find information. So lots of information about different events and things that are happening, different support networks that are available to people throughout the working week. There's a section on systems. So if you want to access, your NHS.net or your Teams or ESR or, your learning management system, all that information's all been included within the app. So I can take this home and get myself configured and get myself up and running relatively quickly. So they're really sort of taking a step back and engage with their colleagues to understand some of the challenges that they're facing and how they can help, and what sorts of information they can distribute on the app itself. They've got a section here on benefits. Again, these are all the local providers, as well as some national providers, that are providing, discounts to colleagues. Again, a lot of these sort of, domestics and clinical staff that don't have access to the internet just don't know what's available to them. So for the trust to be able to include this sort of information onto the app has been priceless. Similarly, again, you've got your alerts section, and you can send out alerts to your user bases about different things that are happening, whether that be events or clinics or whatever it might be. They can be put onto the app and distributed within seconds. This one was great. I love this sort of aspect of it. So this is a pulse check. So we've got forms functionality within the app itself. And if you use things like Smart Survey or SurveyMonkey in the past, you'll kind of know how this works, but you've got the ability to create simple forms or complex forms for that matter, where you can gather information from your audiences. This one is just trying to understand how people are feeling during the pandemic. So just a couple of questions. They were sending this out, using alerts, sending it out to their colleagues, and just asking people how they were feeling and did they have the right equipment, and how was leadership during this period of time, with the idea that they could sort of harvest this information, analyse it, and identify patterns. And if there were problem areas, they could get transformation colleagues to go and have a chat and sort of sort out some of these issues before they got any bigger. So yeah, just a great way of using the survey or forms tools within the app itself. Another area really in terms of apps and being able to use apps is this thing about sort of information efficiency. Again, we continue to hear it can be sometimes difficult for people to go and get access to information. This particular instance is for an accident and emergency team for a hospital in the West Midlands. And the purpose behind this was the consultant was being tasked with reducing the A&E waiting times. Recognised that a lot of the staff working within the team weren't necessarily permanent staff, so a lot of locums working with them, a lot of junior doctors, in some instances medical students, helping out wherever they could. But then, having a look at the team and how it was running, they identified a bit of a backlog of people trying to get access onto the computers. So as a locum, where you're not necessarily sure about the guidelines or the specific policies or the way that we work within this particular team, if you was with a patient, you probably need to make your excuses and go out to the cubicle and then go and try and get onto a computer. 9 times out of 10, you'd be tapping somebody on the shoulder asking if they could log out, so you could kind of log in order that you could go onto the internet to find a simple guideline to just confirm, how this thing works, or what the procedural policy is here. So the consultants saw a lot of this, and I know it was only a few minutes here or a few minutes there, but the cumulative effect of all these few minutes, soon tallied. So what he decided to do was to put all of the policies, guidelines, and any other information that his audience would need onto the app. So for any new starters coming into the team, or for locums coming into the team, they would register on the app. So this is not open to everybody. Register on the app and then be able to go through the app to find the various bits of information. So back to the patient scenario. I'm in the cubicle. I'm not quite sure about this, that, or the other. Well, I could be having a conversation with the patient, pulling my phone out, going into the guidelines, finding the particular guideline, and then just kind of cracking on without having to spend 3 or 4 minutes trying to find a computer to log onto a system to confirm my suspicions. So again, all the information on here, you have to register first, so it knows who you are. This is for specific users within the organisation. Once you're registered, you've got all your policies, all of your guidelines, which quick click on any of those links would open that up within no time at all. Similarly, it's got all the PED guidelines on there, so you can find the information within a couple of clicks. The consultant who's going to run this includes the rota onto the system. So again, thinking about his colleagues and thinking about the information they need to access regularly. They can come on at any point, wherever they are, whether it be home, as I say, on the bus, travelling, wherever it might be, log onto the app and get the information they need. Going back to the forms, he's got a load of sort of operational type forms here. So whether it be request forms or handover sheets or booking forms or training forms, they're all on here. They can all be accessed relatively quickly. His colleagues can fill in the forms. There's workflow within the system, which will then divert that form to whichever inbox is required. And it just makes the whole process a lot slicker, a lot quicker. Their colleagues can fill in request forms at home as opposed to having to try and find the internet and dig it out and fill it in and send it off. It's creating a much more life-work balance for people where they can do more things, where they want to do them, as opposed to having to try and find computers in their own time to be able to do some of this stuff. Again, we've got a directory here, so he's got the name of every consultant, every outpatient department, every service within the community, and you can flick through the directory, press the call button, and be speaking to them in no time. So again, it's just making it easy for people, just trying to understand what it is they need in terms of information, and then being able to provide it to them using the app solution. It's super easy, but it's really efficient in how it operates and how people then can get the information they want, when they want it, where they want it. He's gone a stage further, put all of his mandatory training on there, links to different colleges. Again, he's got all of his alerts, so if the different things are happening, he can alert all of his staff relatively quickly and easily. So there are 4 different applications of the Piota app platform. 2 were very much around sort of patient care. The other 2 were more around staff engagement and sort of information efficiency. But it's essentially using the same platform, the same solution. And as an organisation, we've got experience of working within the NHS. We'll work with you to produce, the look and feel, if you will, show you how to use it, get you up and running, and then support you through the lifetime of your contract. But the solution itself is super simple. 2 aspects to it. You've obviously got the phone on the right hand side, which can be customised. You can put your own logo in there. We can change the tiles and the icons. And on the left, we've got a web-based editor that allows somebody within the team to be able to go onto the system, click into a section, find a page or creating a new page, put some content out there, and then distributing it. And all that can be done within minutes. It's super simple. And I think that's part of the beauty of the platform, and that's why a lot of our clients want this. It is the simplicity. They do want the control to be able to get the messages out without having to rely on too many external teams to be able to do that work for them. So putting it back into their hands where they've got more control is a definite benefit and advantage. And that's why I know a lot of our clients, including the NHS England, do come to us for help and assistance. But you've got the 2 aspects that work together. As I say, it's super simple stuff. You can see now there's the 2 instances on the screen. You can see the editor on the left-hand side, and the tools in there are just the tools that you'd use in Word or PowerPoint. A lot of the functions that you're going to be using, you're already familiar with. There's some different workflow options within the different sections. Again, we'll show you how to use those to make your lives easier as kind of editors. But it's super simple. We provide training to all of our clients on an ongoing process, but it takes 45 minutes, an hour, and then once you've created a couple of pages, you're almost experts yourself. It is easy, and again, that comes back to making it easy for people, make it easy for your audiences to be able to access the information, but making it easy for you to be able to distribute it in the first place. What does the typical app process look like? Well, hopefully at the end of this, some of you guys will be interested and we can talk more about it. But what would normally happen is you'd reach out to us and we can have an initial meeting with you. Majority of the time that's done via Teams, but we can do Google Hangouts or Zoom or whatever is your preferred method. We can have an initial sort of consultation with you, learn more about what you're looking to do. As I say, we've got 120, 130 apps out there, so we've covered a lot of the bases in terms of other teams who have similar problems or similar challenges. We can kind of demonstrate the app and how they're overcoming some of those challenges. So be able to show you, what we can do and how other people are doing it, and then what we can do is produce a trial. And we've found over the years that having something where you can download it onto your device, you can have some of your content on there, it can look and feel and be part of your brand in effect, really helps the conversation internally. If you go show this to leadership teams or to wider teams and talk about the vision here, it's a lot easier if you can take them through the user experience, suggest they can download it onto the device, they can start to have a little click around and see some of their content. It certainly makes the whole process a little bit easier for everybody. So we'll produce you a free trial, 30-day trial. All the emphasis, all the work is done by ourselves. All we really ask is that you provide us with some content, some information, some imagery, in order that we can bring this thing to life for you. You've got 31 days then to take that and demonstrate that and trial it out with your colleagues or with your patients, or in some instances with both, kind of get their feelings, get their feedback. Once you've done that and you're happy to continue, you need to get the agreement from your organisation. We'll go through the boring bits, the POs, the invoicing, and then we'll organise a kind of kick-off meeting where we'll go through the app, we'll go through the configuration, we'll provide you the training that you need, and really start moving you forward, really start getting you going. And and these things can be up and running in no time. Here's a story. I think during the pandemic, we had a chief nurse from an old CCG, again in the West Midlands, that came to us and wanted an app specifically for their care home staff. And they came to us in the morning, and by late afternoon, the deputy chief nurse there was emailing all of the care home managers, instructing them to ask their staff to download this app, and we'd done it within about 8 or 9 hours or something. So these things don't have to be a long, drawn-out process. You don't have to look at this as a development. We've already got a platform that's being used out there by the NHS, a tried and tested platform. It's just really about customizing it for your particular needs. It's not mega expensive. The solution itself starts at about £3,500 for a first year of usage, and then goes up on an incremental basis depending on how many users that you've got that will be accessing the system over the duration, and how many years you take for the contract. But it's not expensive. As I say, I've having worked within the NHS and work with external developers, if you will. This is relatively sort of low cost, especially for what you're getting. The functionality here is great. So that is me. I think that's everything I've got to talk about this afternoon. We said it'd be half an hour, and we're kind of bordering on the half an hour now. So I'm going to see if we've got any questions or any chat within the chat box, and I'm happy to answer any questions you might have. Okay, so just having a quick look through here. I've only got one question at the moment, and it's from Bimmel. Thank you, Bimmel, from the Red House Group. Does the app message then record on the clinical notes of the patients, such as EMIS? We don't at the moment, but watch this space, because we will have very relatively quickly. We'll have the ability to start integrating into PAS systems, systems such as sort of EMIS. Yes, in terms of the Piota app offering, it is not something we do today, but we will be doing very, very quickly. Thanks. Sorry, no mic today. Oh, thank you, Bill. Thank you. I don't know if we've got any more questions there from anybody. I can see, is it Lisa? There's some little dots there. I don't know if you're typing something while we're speaking. Has anyone in Wales used the app, Welsh language? Yes, we have a client in Wales, Lisa, and we've been talking to, we've got a client that's using it that didn't have it in Welsh initially, but we've also now, we're talking to a new client in Wales that is operating around the sort of Welsh first concept. I think hopefully you saw that we can get the app translated into different languages, and obviously Welsh is one of those languages. And what we did with the tiles and the buttons, we had sort of both. So the top of the label was the sort of the Welsh label, and then below that there was a the English equivalent. So yes, we are. One of them was for the care home staff. That's very much live and out there being used. And at the moment, we're talking to a team around cancer patients. So yeah, two apps in Wales potentially using Welsh in there. I think Lisa's going to give me another part to the question. Just wait there for a second. Has anybody else got any questions whilst we're waiting? If you are interested, then please do reach out to us. The marketing team here will be getting in contact with you relatively soon with the ability to contact us. But do reach out. Do come have a chat with us. As I say, we've got lots of experience, and we can show you how other teams are improving communications like yours, and I show examples of apps. So Lisa, it might be easier for us to have a sort of take a chat offline about this, and definitely looking at, it would be great to talk to you a bit more about it in terms of collaboration. So I don't know if we can have a chat possibly Lisa offline, that'd be great. Gina Gold, I think it looks like you're typing a message at the moment. Work with PCNs. We have worked with primary care networks, with ICBs and ICSs. Again, I think we've worked. Oh, Shefford, I've misread that. But Gina, if you want to get in contact with us, then we can take you through and show you some of the work we've done with different areas. Okay. Oh, great, thank you. So thank you all for your time today. As I say, we will be contacting you fairly soon, so please do respond back to us. We'd love to hear your feedback, that we can we can improve these presentations as we kind of go along. But do keep a lookout for us. There'll be different guest speakers coming along throughout the year. But for now, I'll say thank you very much for your time, and hope to see you again soon. Take care. All the best. Bye-bye.